two main components that we're looking at when we're evaluating how what's going on in your mouth can negatively affect your overall health is gum disease and infected teeth. So gum disease can have two different components, gingivitis or periodontitis. Gingivitis is a reversible inflammation of your gum tissue that's caused by the bacteria and plaque. It creates inflammation, which leads to bleeding, but it's reversible, meaning we can make it go away and there's no long-term damage that's taken place. Periodontal disease is where you've actually lost bone, where that infection has progressed. It's been more long-standing or more aggressive in its destruction. And so when we look at x-rays of the teeth, we actually see the bone levels have receded. So you've lost kind of that anchoring support that keeps your teeth stable. While that in of itself is a concern, the bigger issue is that inflammation caused by the bacteria that creates the disease is entering your bloodstream. So whether it's gum disease, whether it's infected teeth that are actually abscessed, bacteria is at the root of all of that. But the bacteria is getting into your circulatory system. So when you see all the headlines about how gum disease is connected to cardiovascular disease, heart attack risk, stroke risk, type 2 diabetes, certain types of cancers, Alzheimer's disease, all the litany of research that's coming out right now is connected to how that infection is creating chronic inflammation. And inflammation is the key to all of this. So treating gum disease is really about ridding our bodies of inflammation just as much as it is about making our mouths themselves healthy. The ways to treat gum disease depend on which type of gum disease you actually have. Gingivitis is a reversible inflammation of the tissue that's really just based on plaque staying along the gum line. So regardless of whether you're using certain types of toothpaste or rinse, it really comes down to just removing that biofilm consistently. As that plaque goes away, the tissue is going to heal, the inflammation is going to go away, the bleeding is going to stop, and there won't be a continued destructive nature to the disease. Gum disease that is actually transitioned into periodontitis, where we've actually seen bone destruction and attachment loss from the tissue, that treatment is going to be more involved. And there's different levels of severity of it, but more or less your treatment is going to consist to some degree of having in-office work done as well as what you're doing at home. So in the office, we're using ultrasonics, lasers, ozonated water, different ways to disrupt the buildup of bacteria and biofilm below the gum line. At home, you're going to be using electric toothbrushes, water picks, flossing, certain types of rinse or gel products that are usually going to contain an essential oil or be peroxide based to be disrupting the bacteria while you're in between visits. But the connection between your in-office and at-home recare program are going to be so important because you can't successfully keep periodontal disease from being destructive just by going to the dentist. You can't just do it at home. There's got to be a teamwork focus between you and your dental care provider to keep that inflammatory process in remission to where you're not continuing to experience destruction of bone levels, bleeding of gum tissue, or the inflammation that results from it.